Seroquel is a brand name for Quetiapine, a medication used to treat a variety of mental health conditions, including schizophrenia, bipolar disorder, and major depressive disorder. It is a type of atypical antipsychotic drug, which works by blocking the effects of dopamine and serotonin in the brain. This helps to regulate the activity of certain brain neurons and reduce symptoms such as hallucinations, delusions, and disordered thinking. The mechanism of action of Seroquel is through its interaction with dopamine and serotonin receptors in the brain. The drug works by blocking the binding of dopamine and serotonin to their receptors, which helps to regulate their activity and reduce symptoms. Seroquel is also thought to have some effect on other neurotransmitters in the brain, such as norepinephrine and histamine. Seroquel is used to treat schizophrenia and bipolar disorder, as well as major depressive disorder. The starting dose of Seroquel for the treatment of schizophrenia is typically 25 mg taken twice daily. The maximum dose of the drug is typically 800 mg per day, although this may vary depending on the individual patient and their specific needs. The recommended laboratory test before starting Seroquel include complete blood count, CBC, liver function tests, LFTs, kidney function tests, KFTs, fasting glucose, A1C, lipid profile, electrolyte levels, and thyroid function tests, TFTs. It is also recommended to monitor for changes in weight and blood pressure. It is also important to review the patient's medical history, including any pre-existing conditions and any current medications they are taking. Like all medications, Seroquel can cause side effects, which can include weight gain, dizziness, sedation, dry mouth, orthostatic hypotension, sleepiness, constipation, and dry mouth. More serious side effects may include changes in heart rhythm and prolonging QT intervals, increased risk of diabetes, and an increased risk of death in older people with dementia-related psychosis. There is a warning issued by the United States Food and Drug Administration, FDA, regarding the risk of mortality in elderly patients with dementia-related psychosis who are treated with antipsychotics. The warning states that these drugs have been associated with an increased risk of death in elderly patients with dementia-related psychosis compared to those who do not take the drugs. It is important for patients and healthcare providers to be aware of this warning and weigh the potential benefits and risks of treatment before starting or continuing therapy with Seroquel.